Okay, lovely. Good afternoon, everybody, and thank you to the organisers for inviting us to do this presentation today. What I'm going to do is give a very brief overview of mesothelioma patient and care research, which has been conducted over the last year. Before I do that, I'd like to express some heartfelt thanks, first of all, to the participants of all the studies that I'm going to mention today and research generally in mesothelioma. Without your participation, we couldn't have learnt what we have and move forward with the care that is provided to people with mesothelioma. I'd also like to thank all those who've helped and informed on the design, conduct and recruitment of studies. And I'd also like to thank all those who've conducted and contributed to mesothelioma research and helped to increase our knowledge. So what I'm going to do today then is talk very briefly about why we conduct research into mesothelioma patient and carer experience. And then I'm going to go on and give an overview of current and recent research studies that are taking place in the UK. And then I'm going to mention briefly a very exciting development, which is the creation of the Mesothelioma UK Research Centre in Sheffield. So first of all, why do we conduct research into patient and carer experience? Obviously, a lot of research that gets mentioned in relation to mesothelioma is about clinical trials, and that's really important in knowing which interventions are effective for people with mesothelioma. However, in order to develop new interventions and services, we need to understand better about patients and carers' experiences through pathways of care. And that's what patient and care experience research aims to do. Through talking to people, observing care, we hope to learn from that research and use that knowledge to develop new interventions. So we aim to identify what care and support needs are linked to innovations and what new innovations are needed. And we also need to understand health professionals' experience as well, so that we can understand better what new interventions are feasible and realistic. It's very important that we challenge our assumptions of what is happening to people with mesothelioma. And I think a lot of care can be informed by assumptions which don't go tested unless we're careful. So a lot of the research into patient and care experience does sort of challenge people's prior assumptions. And the other aspect of patient and care research is into people's experience of clinical trials themselves, so that we can improve trial design and make participation in trials better. So we do need to know what interventions are most effective, but we also need to know what treatments are acceptable, accessible to people, and why. And that's what patient and carer research aims to do. Okay, so I'll move on now and talk very briefly about current and recent research into mesothelioma patient and carer experience. So the first few studies that I'm going to mention today are actually funded by Mesothelioma UK through a Lung Cancer Nursing UK Research Award. And this has been offered for the last few years, administered through Lung Cancer Nursing UK Research Group. So the first project I'd like to mention is about living well with malignant pleural mesothelioma. The aim is to provide insight to improve patient and family care experience. This has been led by Dr. Karen Lord, who's a clinical nurse specialist in Leicester. And the aim is to develop some evidence-based recommendations to help people live well with mesothelioma. Karen has completed her interviews with patients, family carers, and health professionals. So the study is now complete and the report will be published in autumn 2020. The second project I'd like to mention is being conducted by Dr. Matt Johnson, who works at the Brompton and Harefield Hospital in London. And his study is to explore the experience of long-term survival in people affected by pleural mesothelioma and their carers. And again, the aim is to develop in-depth insight into people's experience with longer-term survival and try and understand the long-term emotional impact of living with and caring for somebody with mesothelioma. This is an interview-based study with patients and family carers, and unfortunately it's being delayed by the current COVID-19 situation, but Matt is planning to commence the study in January 21. So look out on the Meso UK website for details. The next two studies I'm going to mention are being led by Kathy Henschel, who works at Oxford Brookes University. The first study that's been led by Kathy is exploring patients' experience of follow-up care after treatment. And it's being conducted in 3 NHS trusts, all of which have different models of follow-up care. It's a qualitative study that's included documentary analysis, interviews, and then consultation with stakeholders. It actually finished at the end of last year, and there are various plans for dissemination, and also an output of some infographics that have been designed to disseminate the recommendations that have been developed. Some of that dissemination, sadly, has been delayed by COVID-19. Kathy's second study is looking at clinical decision-making related to mesothelioma treatment pathways. And again, this is in 3 different NHS trusts to compare how decisions are made in different contexts. And the aim is to develop a collaborative evidence-based approach to mesothelioma clinical decision-making. Now, this study has started in October 2019, but was due to finish at the end of this year, but sadly has been delayed. So the end date has been extended to May 2021, but Kathy is on target to deliver the study findings then. I'm now going to move on and talk about some studies that have been conducted at the University of Sheffield, which is where I work, in the Division of Nursing and Midwifery. And we have a portfolio of studies that focus on patient and carer experience. The first study is the Military Mesothelioma Experience Study, which we've termed MiMES. This is part of a wider initiative by Mesothelioma UK on supporting our Armed Forces project. But the MiMES study aimed to explore the experience of British Armed Forces veterans with mesothelioma, but also the experience of their family members and health professionals, and also support agencies such as legal firms and Veterans UK and asbestos support groups. And we aim to identify how best services can meet the health and support needs that we identified in the research, and how they can better meet patient and carer needs. We started off with some stakeholder consultation, conducted some interviews with military veterans with mesothelioma and their family members, and then conducted some focus groups and consultation. This study is being led by Steph Ejegi-Meme and Beth Taylor with myself. I won't have a lot of time to give findings from studies today, but I'm going to give just a few highlights. And from the MiMES study, the data that we generated does challenge assumptions regarding who has been exposed to mesothelioma whilst in the armed forces. And it highlights the importance of raising awareness of the risk of such exposure across all 3 services, Army, Navy and RAF. The findings do indicate the importance of skill and sensitivity and experience when looking at occupational history taking for people with an armed forces background. And it also identifies how experience in the armed forces can change people's approach to coping with mesothelioma later in life. And they tend to have a more stoic and proactive approach, according to our participants. We looked at how military service and culture can influence care needs, but also how veterans access care. And we looked at how the importance of expertise and experience when supporting people navigating the health, legal and military systems. And the fact that somebody has a military background does change the complexity of navigating those systems. For some veterans, they saw some inequalities between their experience of living with mesothelioma when they compared that to civilians with mesothelioma. And our report also highlights some of those inequalities. But we also highlight the importance of maintaining awareness about asbestos exposure. And the participants did express concern about ongoing asbestos risk within the armed forces. So we now have our report that's been published. We've got publications submitted for peer review. The report can be accessed at this link here. And we've also recently recorded a virtual event with a number of talks about the study and the wider Supporting Our Armed Forces work, which you can access on YouTube and through a link from Meso UK. Linked to the MiMES study is a PhD study which being conducted by a PhD student, Virginia Sherborne at Sheffield. Virginia has made fantastic progress by conducting a literature review, evidence review on the psychological effects of mesothelioma on patients and carers, and that's now been published in Psycho-Oncology and is open access, so anybody can get that article. She is now moving on to do her main research project, and she will be starting to recruit in September. The focus of Virginia's research is on family carers of British Armed Forces veterans with mesothelioma and trying to understand how better to support the family carers through their journey. And so Virginia will be recruiting in September. And if you are eligible to take part, she'd love to hear from you. So if you are a family member or friend of a British Armed Forces veteran with mesothelioma, do contact Virginia, and her email address is there. But if you have any trouble, I'm sure the Mesothelioma UK helpline will be able to help direct you. So the next study I'm going to mention is the gendered experience of mesothelioma, which we've titled GEMS. And this study was generated really in response to clinicians and legal professionals who were concerned that there might be a gender difference in experience of mesothelioma, and we aim to explore what the similarities and differences between men and women in terms of risk, exposure, presentation, diagnosis, access to treatment, compensation, and legal services. So we conducted secondary analysis of some national data, some quantitative data. We conducted secondary analysis of existing interviews and conducted some new interviews. And I'd like to thank the funders of this study, who are listed below on this slide. Again, Stephanie Ejegimeme led on this study. The study is complete. The report is nearing completion and will be available on the Meso UK website soon. We have our first publication accepted by Cancer Nursing Practice, so that should be in print soon, and another paper about to be submitted shortly. Again, just some selected findings from our analysis. We couldn't identify any significant gender differences in terms of treatment and care experiences following diagnosis. So that's a very useful finding. So no differences between men and women in terms of treatment. However, we did identify a few points of interest relating to gender. One related to high-risk occupations, and they are very different from men compared to women. So for men, they were mainly, as you would expect, in construction and similar high-risk occupations. For women, they tended more to be working in buildings where there may be asbestos. So office work, administration, teaching came up quite highly with women. So we can't really think of high-risk occupations being the same for women as they are for men. We identified that women of all ages and younger men lacked awareness of the dangers of asbestos exposure. And there were also some gender differences in terms of the experience of explanations and support provided around the time of diagnosis. Men and women's roles within the family and within society were also seen to influence how people coped with their diagnosis of mesothelioma. And finally, women were less likely to access legal advice and receive industrial injuries disability benefit when compared to men. So the report will be out shortly, and there's more information in that. I'd now like to mention the Mesothelioma Asbestos Guidance Study, or MAGS. One of the reasons this study has been referred to as MAGS is in reference to Mags Portman, Dr. Mags Portman, who was diagnosed with mesothelioma in 2017 and sadly died of the disease in 2019. Mags was a very campaigning doctor who wrote in detail about her experience of mesothelioma quite passionately. And as a healthcare worker, has kind of inspired this study, really, the aim of which was to develop a critical account of the experience of mesothelioma from the perspective of people who are healthcare workers and who develop mesothelioma following workplace exposure to mesothelioma, to asbestos. So the design of the study was a rapid evidence review and stakeholder consultation, and then 10 semi-structured interviews with healthcare workers diagnosed with mesothelioma or their families. So Peter Allmark led on this study. The study is now complete. The report is available in the Mesothelioma UK website, and an article is available in Occupational Health Today, which is literally just being published, and the link to the article is here on the slide. Again, some selected findings from Mags. Firstly, there were similarities amongst healthcare workers, as you'd expect, in terms of the physical experience of mesothelioma from when compared to people who didn't have a healthcare background. However, for healthcare workers, they reported a strong emotional response to the diagnosis that seemed to be exacerbated by prior knowledge of their condition because of their clinical experience. Also, healthcare workers talked about their care in a particular way, and also sometimes there were care issues because their colleagues tended to treat them as colleagues rather than patients, and sometimes assumed that they had better knowledge of the disease and than in fact they did have, because they had been doctors or nurses in the past. Just a little bit of knowledge about the number of cases. The ONS data that we know reports mesothelioma deaths in different occupational groups. Between 2002 to 2015, they reported only 177 mesothelioma deaths amongst health and social welfare professionals. As part of the MAG study, Peter conducted some freedom of information requests, and for the same number of years, but 2 years on, from 2004 to 2017, he asked for information of all those who had claims made against the NHS because of a diagnosis of mesothelioma, and the freedom of information request reported 961 such claims. So these are all people with mesothelioma and all people with a background of working in healthcare. About half of those claims were actually successful, but so we then had to think about what's the reason for this discrepancy and the lower number amongst the ONS statistics. And we know that ONS no longer records former employment if people die after 75 years of age, and many people with mesothelioma will be over 75. But also the ONS data doesn't pick up all those who work in a healthcare environment. They will pick up doctors and nurses, but there will be lots of people who work in construction, work as a porter, work as a cleaner, or in laundries, and we don't know whether they're in the NHS or not. So at the moment, what we can claim from this is that we feel that there's an under-reporting of the volume of people with mesothelioma with a healthcare background. So the next study is the Palliative Care and Mesothelioma Study. This is being led by Claire Gardner and Madeline Harrison. And this study aims to understand the palliative care needs of patients with mesothelioma, and also the role of the Mesothelioma UK nurse specialist in supporting patients with mesothelioma and advocating their palliative care needs. This study is involving a literature review and a survey and nurse focus groups with nurse specialists. The study is in progress at the moment, and it's the literature review is complete. Publications are planned, and the survey and focus group will follow. The literature review has identified that patients do face a great deal of uncertainty when it comes to introducing the need for palliative care, and has identified a number of complexities and concerns about delivering palliative care to people with mesothelioma. So what I'd like to do in the last few minutes is just raise the issue of the Mesothelioma UK Research Centre in Sheffield. Earlier on this year, we took part in a national tender and were fortunate enough to be successful in being awarded the contract to set up the first Mesothelioma UK Research Centre, which we have, which is a great privilege to do, and we're really excited about doing this. So we are hoping to launch the centre soon, and we are in the process of putting the nuts and bolts together as we speak. Our vision is obviously to conduct a portfolio of robust and rigorous research, which has a reputation for excellence nationally and internationally, but more important, is relevant and in tune to the needs of people with mesothelioma and their families, and that makes a real contribution to knowledge and informs policy. So our goal is to have a real impact with the research that we deliver. The research centre is being led by myself with Dr. Claire Gardner, and we're lucky enough to have a fantastic team of brilliant and bright young researchers. And so we're really excited about the next 3 years, and I really hope to work with many of you in the room on this call to drive forward knowledge and understanding about mesothelioma patient and care experience. Joining Virginia as a PhD student is going to be Emily Couchman. So she is going to start her PhD shortly. One of the first things that the Research Centre is going to do is to conduct a research prioritisation exercise. And this will build on the 2013 James Lind Alliance Priority Setting Partnership exercise, but it will broaden out the research topics that were highlighted in the James Lind Alliance exercise, and we will include patient experience topics. So our aim in the research prioritisation exercise is to identify unanswered questions about mesothelioma patient and care experience, and then prioritise these so that we will focus our research on the areas of greatest need. Now, we think this prioritisation exercise is going to consist of a series of discussions and events, many of which will have to be online or on the telephone because of COVID. So that some of them will be group discussions, individual, but we hope to be inclusive. Our goal is to start this process in October. And if you're interested in taking part, please do get in contact. So there are some email addresses there for you to contact us. But again, do contact Mesothelioma UK if you feel you'd like to take part. Just to highlight, there are a number of existing projects that we're going to get going on immediately while we're alongside the research prioritisation exercise. We're conducting a rapid review of evidence on mesothelioma patient experience. We're conducting a study about mesothelioma in schools amongst education workers. We're exploring research priorities in peritoneal mesothelioma, and also working up a study looking at the impact of COVID on patients and staff. And also Matt's study that I mentioned earlier will be integrated into the centre. So again, do contact us if you've got ideas for research, if you want to participate in the research prioritisation exercise, and here are our contact details again. So thank you very much for listening to me today. And it's been great to be here and take part in the proceedings today. And we look forward to hearing from you in the future. Okay, thank you.